Specific phobias. According to DSM-5, specific phobia is a marked fear or anxiety about a specific object or situation like flying, heights, animals, receiving an injection, or seeing blood. There are many specific phobias that are basically a fear of a particular scene or situation. Some of the most common specific phobias are glossophobia. This is a performance anxiety or the fear of speaking in front of an audience. As you already know, this is a type of social phobia. People with this phobia develop severe physical symptoms when they even think about giving presentation in front of a group of people. Acrophobia, or the fear of heights, originated from the Greek akron, meaning peak, summit, edge, and phobos, fear. Sufferers with this type of phobia will avoid bridges, mountains, climbing a ladder, or the higher floor of buildings. Acrophobia belongs to a category of specific phobias called space and motion discomfort. Acrophobia can be dangerous, life-threatening, as sufferers of this condition can experience a panic attack in a high place and become too agitated to get themselves down safely. It can also have a negative impact on life of those individuals who develop acrophobia, limiting their career opportunities as well as affecting simple day-to-day situations, such as helping your child out of a tree, making holiday choices, painting a ceiling, or even changing a light bulb. Emotionally and physically, the response to acrophobia is similar to the response to any other phobia. You may begin to shake, sweat, experience heart palpitations, and even cry or yell out. You may feel terrified and paralyzed. It might become difficult to think. Claustrophobia is a fear of enclosed or tight spaces. Severe claustrophobia can be especially disabling if it might prevent you from riding in cars or elevators. Aviatophobia or aerophobia is the fear of flying. Dentophobia is the fear of the dentist or dental procedures. This phobia generally develops out of an unpleasant experience at a dentist's office. The harm is that it may prevent the sufferer of dentophobia from obtaining much-needed dental care. Hemophobia is fear of blood or injury. A person with hemophobia may faint when they come in contact with his or her own or another person's blood. Animal or insect phobias. The most common phobias from this subgroup are arachnophobia, fear of spiders, cynophobia, fear of dogs, and ophidiophobia, fear of snakes. These often develop out of normal childhood fears, but may be connected with a past experience like an animal bite. Necrophobia is fear of death or anything related to it. Nyctophobia is fear of the nighttime or darkness. This phobia almost always begins as a typical childhood fear. However, when it progresses past adolescence, it's considered a phobia.